This is the STL Medical Weight Loss Radio Show with Dr. Joe. No more talking, let's go.
Welcome back to the STL Medical Weight Loss Radio Show. I'm your host, Dr. Joseph Moleski. We're excited to have everybody back for a fresh episode this week. I want to start off by what I see commonly in my practice is, patients coming in that are obese, okay? They have a BMI that's over 30 and they're wanting to make change. And I would beg to say, making obesity and chronic disease optional. And that slogan, I'll say it again, we are trying to make obesity and chronic disease optional. And what I mean by optional is, even if you have a family history of, let's say, your mother, father, grandfather, sister, brother, whatever it may be, has lived with, let's say, high blood pressure, diabetes, high cholesterol, those are the typical offenders, you don't have to live with it or develop it. And so even though you might have the genetic profile or it runs in your family, or high blood sugar runs in your family, or neuropathy, or dementia, or heart disease, heart failure, these chronic diseases, just take a minute and think, do I have to live with this? Do I have to live with those risk factors? Granted, if you continue to be obese or have an unhealthy, lifestyle, then yes, you likely will develop those chronic diseases that run in families. But I would beg to say, what if we could make that optional and you did not have to do that? And so at STL Med, what we really strive to do is look at where you're at and where you want to be. So, I like to describe it as, if you plan a vacation and you decide, hey, I want to go to Florida and I want to go to the beach. And that's my end destination. That's where I'm going to go. That's fine. But it takes time to get there. You have to, pack, you have to plan, you have to, get a rental car, you plan the flights, you plan the accommodations, you plan, the family members that you're bringing. And so I like to describe it, that's the same kind of journey that we want to take with you. You might have the end result, you state, hey, I want to lose 30 pounds. I want to lose 50 pounds. And we talk about your why. What is your why? Why do you want to lose that weight? Is it to, have less pain in your joints? Is it to feel like when you wake up in the morning you have, more energy? Is it for confidence? Like, yeah, it's the summer months and I like to feel confident in my skin when I go to the pool or when I'm out and about. I want to fit into a certain dress size. I want to fit into a certain pant size. I want change. And so what we like to do is focus on results. We want to focus on you and we want to focus on your why. And I've said this in, multiple other shows, but we use these medications as a tool to get you to your why and to get you to that end destination or that end goal of, that ideal BMI or that ideal body weight that you desire. We want to work with you and we want to make sure that you're educated on how the medication works. We want to make sure you feel confident in the medication that you're receiving, and most off, you feel confident in the whole process from start to finish. And we like to educate folks on, if there's any side effects, we like to help with that. We are happy to send off meds that can help with some of the side effect profile, being number one being nausea. But most of the time we see that these medications are very well tolerated and we're seeing, incredible results. And one of the things that I also want to bring up is just imagine, there's so many people living with diabetes, high blood pressure, heart disease, stroke, all these chronic conditions. But wouldn't it be great to almost have it to where some of these things were a thing of the past? And I'm not saying that we're going to cure everything. I'm not going to say that. There's technological advances that are happening. There's studies that are coming out with these medications. All I'm trying to say is the root diagnosis of a lot of these problems are, their obesity and what we're consuming. And I always talk about food as medicine. And so I'm just going to give you an example. So I have a severe bleeding disorder, and I've shared that on a few episodes, previous episodes. So it's a bleeding disorder. I have to do intravenous infusions to maintain my, my factor level in order to make sure my blood clots. And so I am involved in the hemophilia community. So last week I was at a hemophilia convention, and there's people coming by the booth and want to talk with me about my personal experience with hemophilia, and I'm very active in the hemophilia community. Well, it was interesting. I had one person come up to me and say, Dr. Moleski, I have a question for you. It's not hemophilia related. I have tingling in my feet. The gentleman was relatively young, in his 30s, and he just said, this is not hemophilia related. This is something different, and I don't know what it is. Can you help me? So I started just that basic questionnaire with him, just going from top to bottom, and he was a little bit overweight, and I asked him, I said, how long has this been going on? He said, it's been going on months. I get these pins and needles in my feet, and I don't know what it is, and I need your help. So I started asking him, okay, do you have any family history? So that's where I start is, do you have any family history of diabetes? Does your dad have diabetes? Does your brother, sister, aunt, uncle, mom, dad? He said, yeah, diabetes does run in my family. And I asked him, I said, who has diabetes? He said his dad did. And so I said, then I get into, okay, there's a family history of it, but what about you? What do you do? What is your lifestyle? Tell me a little about that. And he was saying, I don't have the best diet. I don't work out much. I have a sedentary job. And the next question I said, go back to your sugar consumption. I go right into soda. How much soda are you drinking? He said, throughout the week I drink about 30 cans of soda per week, 30. And his soda choice was Dr. Pepper. And then I started asking him, okay, have you ever had blood work done to check to see if you're diabetic? He said, actually I have. I recently had an A1C where it was about 6. And so I was like, wow, okay, you're a pre-diabetic, and what you're experiencing is what we call the early signs of diabetic neuropathy, which is where high blood sugars, okay, in that pre-diabetic state, irritate the nerves, and it causes you to have numbness and tingling in your legs. And so the reason I bring up this example is a lot of folks don't realize, even at a young age, as I said, I'm seeing people come into the hospital with heart attack, strokes, new diagnoses of high cholesterol, high blood pressure all day, every day. And it all stems in what you consume, what you put in your body. So if you have a diet that's filled with high processed foods, lots of sugar, there's a chance that you could develop diabetes, even if you're in your late 20s, early 30s. And then you give that, 20 years or 15 years of high blood sugars, you're going to develop strokes, you're going to develop heart attacks, because what happens is those high sugars, they irritate the vessel walls, they cause narrowing, they can cause what we call ischemia, or decreased blood flow to the brain. That's called a stroke, or the heart, that's called a heart attack. And then you develop these worsening side, I'll call them comorbidities associated with diabetes. You can develop kidney issues. Then you can develop this neuropathy that patient was describing, where you get pins and needles, you can't feel your feet. And what happens is patients develop, diabetic ulcers in their feet, and then it leads to amputations. So sorry to go on a tangent, but I'm really seeing a lot more people, not even patients of mine, just looking around, and I see it through a doctor's lens. And I'm seeing a lot of people that, even if they're not at that overweight, obese category, they're having that, some of these pre-diabetic signs and symptoms. And that goes back to illustrate 1 in 3 patients are pre-diabetic. So what we do at STL Med, we do a full analysis, we do lab work, we take a look at the whole picture, your family history, and what we want to do, and my goal, the reason I'm doing this, is I want to see you have the results you desire, but I want to reverse disease, and I want to prevent disease. That's why I got into this, and I'm super passionate about helping individuals understand their health, provide the education that they need, make sure they're at peace when they sign up for us, and then set up a 90-day plan in order to get you back on track. I always say, patients, give us 90 days, we'll change your life. Give us 90 days, we'll change your life. If you have any further questions or want to book an appointment, that's the best way to get things started. Please book an appointment at STLMedWeightLoss.com, or you can call to make an appointment at 636-628-6604. Once again, best way, book an appointment online, STLMedWeightLoss.com. That's an easy way to get started.